everyone, this is Dr. Vikas. So again we are in Perm State Medical University. So today we are in Department Stomatology. So as you saw previous video, we show other department also. So today we decided to show you our stomatology department. So after graduation, many students are interested to be dentistry in stomatology PG also. Because you know in India we have lots of diseases also, cancer, cavity cancers, mouth cavity, everything. So let's have a view stomatology department. First of all, we'll enter our head of the department, Olga Gileva. So she will more explain to our department.
Pleasure for me, for us, for our staff to see you in our department.
Thank you.
Thank you. So as far as you're welcome to colleagues.
So today we are in stomatology department. Olga Gileva, head of the department. So Olga Gileva, we just wanted that to our viewers you will explain about your department. Because in India we have very popular that they really interested after completing their MBBS or BDS, want to in PG, also in stomatology, and after of course in graduation. So today we have a possibility. So please explain us.
Okay. Once again, it's a pleasure for me to see our postgraduate from India who is interested in the process of education, young generation, young boys and girls from India in our university. I guess you are not afraid of dentists.
Of course.
Are you? Okay, you have a nice smile, by the way.
Thank you.
It's professional estimation.
Thank you very
Yes,
much.
as far as I understand, today can I take it off? It will be better for all of us to hear. As far as I understand, we have a chance to talk with some Indian young people who have graduated from the secondary schools and standing and thinking about their future profession. Yes? Not only boys and girls, but their families too. And as their head of the Department of Conservative Dentistry of our dental faculty, as an ex-dean for foreign education in our university, of course I have something to say about our profession, about dentistry, to Indian young generation once again. Maybe because they are from India, a country with ancient history, with fantastic culture, a country of amazing, hardworking people whom we know, whom we respect, and whom we are waiting in our university. So of course you want to hear from me what is dentistry, why should you choose the profession of dentist, etc. So first of all, I want you to know that dentistry is a field of medicine, not something concrete standing opposite medicine. Dentistry is a part of general medicine, big medicine, let's say, when practitioners, when dentists thinking about how to improve systemic health by means of different dental manipulation. For example, how to improve the quality of life of our patient. For example, by means of treating teeth, gums, oral mucosa, or maybe teeth bleaching or oral hygiene. Yes, you know this. Maybe I'm sure that you have visited dentists sometimes.
No. Thank
Never.
God, still not. Yeah.
Congratulations, congratulations. But I know that some gum problems, periodontal diseases are quite serious problem for Indian population.
In India we have a really serious problem. Because
Yes.
in India normally people are used to tobacco. So
Yes,
just because of tobacco we have.
Let me say it's big mistake.
Yeah.
Let me be sure that you will stop smoking sometimes in your life. I want to see.
Our government is working on that.
Yes.
So still we have a huge control on this problem. So hopefully in future people will.
Yes, and I know that a lot of government programs, anti-cancer programs, saying why you shouldn't smoke, why you should stop smoking according to cancer risk, etc. That is a right way for any government, including Indian government too. Then, for example, once again, I'm explaining how to improve systemic health. For example, to do prosthetic treatment for patients with teeth missing, tooth loss, using different modern technologies, implants, brackets, teeth replantation, aligners, etc., etc. In some cases, our patients need to restore surgically different trauma or infection, maxillofacial diseases, or after cancer. And that is, these are the obligations of maxillofacial surgeons. And it's crucially important to start dental management from early childhood, or maybe just from the beginning of a mother's pregnancy. Just to have a good teeth and good maxillofacial region through all the life. That is the obligation of a pediatric dentist. So that is dentistry. That is our professional duties. And you can think about different profiles or specializations in dentistry. Maybe conservative therapist or therapist, maybe orthodontic, maybe prosthodontic specialist, maybe maxillofacial surgeon, maybe pediatric surgeons. So that is what dentistry is, how to become dentist. For example, in our university. So first of all, you need to graduate from secondary school with appropriate certificate.
Of course.
Then pass 5 years course of studying in our university. Then you need to pass a lot of transitional and final exams. Then you or our future applicant need to pass a special multi-level accreditation test performed by our Ministry of Health and receive a degree of dental specialist or dentist. Then you should think what kind of dentistry, what specialization you will choose. Once again, conservative dentistry, prosthetic dentistry, orthodontic, maxillofacial surgery. So then you need to have a course of residency. Depends upon the profile, from 2 to 5 years long. And then you will work intensively. You will work whenever you want in different countries, in Russia, in India, after passing some special tests, depends upon the country, and have a good profit.
Definitely. So we have different country students also studying here.
Yeah.
So can you explain how many country students are studying currently?
Students here, something about 1,000.
Students, yeah.
Yes.
From different countries.
From different countries. Just now in this semester, from 12 or something around 12 countries.
Okay,
yes.
12 countries.
Including, of course, our Russian students.
Okay.
So it's a kind, in our department, in our university, it's a really international education.
Okay.
So
after completing their degree, they can work in their country also.
yes, of course.
So there is a not a problem.
Yes, of course. Moreover, if, for example, you are a student from India, my obligation is analyze the dental status of Indian population, trying to find the most important moments need to be improved by my student who will come to return to India and help. I know that you have, Indian population have some problems in oral cancer.
Yeah, we have huge number of oral
yes,
cancer.
in congenital diseases
Yeah.
of maxillofacial region, etc., etc. That's why analyzing your real situation in dental status, we let's say sometimes correct our curriculum, paying attention to your native problems. That's why when our students return to India, they know what that they need to do with their population, with their families, with their parents,
Yeah.
sisters and brothers, friends, etc. Patients. Anyway, patients, dental patients.
And I just want to know about the faculty. Yeah, our faculty is all throughout English medium.
Once again,
Our faculty, the teaching staff, they are speaking well English.
oh yes, yes. So you know, it's a good tradition in our dental department that almost all of them are well educated in different languages.
Okay.
Mostly in English, of course, but there are some my colleagues.
So whole duration will be in English medium. First
Yes,
to
of
fifth
course.
year, right?
Yes, of course. In French, for example.
French also.
So yes, English, French, and Russian.
Okay.
The main languages we use to educate our students.
Okay.
Yes.
Okay. So this is good for our students that we have throughout fifth year English medium. So I think there is a good opportunity for Indian student, because especially for Indian students, they want to study English medium. So it's really good.
So I think it's good for all students,
Yeah.
all medical students, all dental students to know not only their native language, to catch as much as possible
Yeah,
your
that's the main
education.
reason. That's the main reason.
Yes.
Because to learn Russian language and to study, of course, this is a little bit different. So,
Yes.
of course, this is better for them.
But it's good to know Russian too for our Indian
Yeah,
students.
definitely.
So the way of communication in native languages is very important.
No, definitely, they need to learn because they have to survive
Yes.
here also 5 years.
Yes.
So this is not only for study; they need to be survive friends and everything. That's why they need Russian language also.
Yes, you're right, absolutely. You're right. So while studying, I want you to know it's not only classes, manual skills, but we pay attention to raising their mental abilities, their design capacities, their artistic manners, because dentist is an artist too. You couldn't do aesthetic restoration without good eyes, without good aesthetic view on the face of our patient. So, and we have a chance to show the works of our students.
Yeah, we
to
really would like to, if you will show us the department.
Yes, yes, we can go there. We can go there. And by the way, outdoor different life of our students. For example, sport games. Okay, whatever you want. Volunteers movement. Okay, whatever you want. Music, artists. You can find everything in our university, in our city. It's a pity, it's rainy day.
Yeah.
But someone told that rain is symbolized of happiness.
Basically, I love
Yes.
very much.
Yes, yes, yes. Yes, and I also think about our Kama River is like Ganges River, long and very majestic.
Yeah,
So that's why I guess a lot of our foreign students like Kama River and have spent their free time on the bank of Kama River.
It was good that our hostel also located near the Kama region.
Yes.
So after their class, they love to be,
Yeah.
visit there
Along the river.
along the river.
Yeah, yeah,
So it's
yeah.
really beautiful. Yes, sometimes I'm also going in evening time. So it's really beautiful. It's really beautiful.
And once again, talking about pros and cons of educating for dentistry in our university. First of all, it's education in the city of Perm. What does it mean, Perm? The middle part of Russia. Let's say the heart of Russia.
Yep.
Yes?
Yeah.
Near Ural Mountains.
Yeah.
Yes. Surrounded by forests. Nice views, nice nature, nice air. That is important for those who wishing to stay here for 5 or more
Apart
years.
from study, we have really good nature.
Yes.
And of course, the city is big.
Yes.
We have international airport. So
Absolutely.
we have really very good possibilities in Perm,
Yeah.
especially heart of the center. So
And important is that it's a calm and quiet territory.
yeah.
So that is important in our modern world. Yes.
That's true.
So that's why, of course, we will be glad to see students from India in our dental faculty. By the way, we have an experience, I mean my staff and our dental departments have a good experience of educating our students from India who are the students of medical faculty, because they have a short course in dentistry too.
Okay.
So-
So we have short course.
Yes.
Like 1 year, 2 years. Something.
Yes, yes. And I say, would like to stress that it is a very, very polite students.
Okay.
They are well educated. They are open for education. They are ready to help patients. So they are good for future profession of medical practitioner. I guess the same I can see in my Indian students of the dental faculty.
We hope.
And never mind, boys or girls, all of them.
So our professor, as the professor said that we have some courses, short-time courses.
Yes.
In India, normally we say it's diploma courses. So if a student want to be a part of short courses, okay, they can also join us. And the professor really love to see our Indian students, of course, girls and boys. So this is our whole conversation about the Stomatology Department. And apart from, she said about the city, that Perm region is located in the middle of the Russia, surrounding by the mountain, towards the forest. We have a really beautiful river, and 5th or 7th largest city.
Yes.
I hope so.
Yes.
So Perm city is really very big, a huge population here, and the benefit of the big city is that the possibility of patients we have really big, because if we have a big population, so patients, of course, we have a large number of patients for practical skills also. Apart from, we have an international airport in Perm city, so this is really beneficial for international students. They can come direct to the Perm. So still there is no flight direct from India to Perm, but hopefully it will be start in a short time. So this is our whole conversation with our professor, and now we would like to show the department.
Yes. We need to know that according to the time of coronavirus infection, we have some contraindications to visit dental clinics.
Okay.
But we have a unique chance to visit some departments and to see our students, to talk with them and to talk with our teachers. And I wish they can see something interesting for future Indian students too. Let's go. Let's take the precautions that we need to do. Or you may filter these
So this
documents.
is all certificates, yeah?
Yes. International certificate from our head of the Ministry of Health of Russia. From
European Association of
Zagreb, Germany,
Okay.
Germany, Israel, here in Israel, yes, Hebrew University. This is from South Korea. South Korea, so different our professional words. So that is from Dubai,
Okay.
from United States, from Czech Republic, from Germany once again,
Okay.
and here Minnesota School Dentistry. So I have a lot of colleagues in Minnesota School of Dentistry, and by the way, we have a lot of international projects in our collaboration. Yes, and we try to involve our students in such if they want, if they can, we organize a kind of scientific work for our students.
So as we already said in previous video that we have collaboration in different countries. We have interactions program.
Yes.
So students can come from other
Yes.
countries here also, and our students also going for interaction program for a short time. So this is really good possibilities in our university. To know the culture, the education,
Yes.
everything.
Yes.
Can that continue?
That is important. Let's go. We usually start the education from pre-clinical course. What does it mean? Let's go to the room and see by our eyes what does it mean? Pre-clinical course or front-home education. That is very important for our students because we couldn't sit down near our patients. The student on the first floor. Yes.
So now we are going to enter in a class.
Yes.
So live class, how the teachers, how they are studying, so
Yes.
how they are giving a lecture.
Yes, you're welcome. Let's go.
Phantoms, where our students can improve their manipulation skills for preparation, for filling of the teeth, and to make different measures. And actually, this phantom class is the class where we can predict the specialization of our student. For example, this student is very impulsive and he wants the result here and now, and we can recommend him direct restorative dentistry. So the other student is very patient and likes to make different small manipulations, and we can recommend endodontics. Other students, they work with the virtual patients, and this is the practice where they study to ask correct questions and to get the correct answers. And they improve the intelligence, so their mental skills, and it's very important, for example, for oral pathology specialists, because they need to connect symptoms and diseases, and it's very important. That's why we can find the job for any students because of some strong sides and weak sides of every student. So this is our prediction rule, I can say.
So yes, it's very important stage of dental education. Just starting from manipulation on phantoms and step by step transforming into dental clinic and have their own, let's say, students' dental practice. So the opportunity to treat patients is in reality in our university, of course under the guidance of our teachers. who are doctors at the same time. Sure, you need to have the time for teaching. Thank you so much.
Thank you
Thank you so much. Be a good doctors, and do you want to say something to our Indian boys and girls who are on the connection, online connection?
I think that all students will agree with me to join us.
Okay. Thank you so much. Thank you so much. You may sit down. Oh, it's a kind of ladies' room, yeah? Yeah. According to, once again, COVID restrictions, they are sitting in a chess lane, that is important. And sorry for interruption, but could you tell us something? What are you doing now?
Today we are working with impression materials. So,
You may come to
the
see
Department
something.
of Prosthodontic Dentistry, and if you want to be a specialist in prosthodontics, you must have good, how to say,
Manual skills.
manual skills,
Mhm.
yes, design skills. You must work with different materials such as plasticine, wax, gypsum materials, and even soap. Sometimes we use wood for making of different models of our teeth.
For foreign students, especially for Indian students, we have online classes going on right now. So they are studying distance learning. So I just want to add on the one more thing for new students who also want to take an admission right now. So admission is open in Perm State Medical University. As a deputy dean, I am telling you that you will not lose your year if you are part of our university, and your classes will be online till the condition will be not in a proper way. So you don't have to worry about that. If you want to continue your study, don't waste your time. So admission is open in our university. As we already said that our university is 100-year-old university and very prestigious university. As you already saw that our all professors are well English speaker. So in Perm State Medical University, we are teaching in first to sixth year. Again, I want to add on that first to sixth year we are teaching in English medium. So if you want to part of our university, you're most welcome. Admission is open. So they are really very great to see you here in our all department. The peoples are really humble in Russia. We have a good relation in Russia also. So you don't have to worry about that for anything. We are maintaining the whole COVID precautions also here. So also parents, if you are you want to send your son or daughter here, so don't worry about that. We have our all responsibility of your child.
Department of Pediatric Dentistry with us. Hello friends, hello students. Hello. Can I introduce you? Assistant Professor, let me sit down, of the Department of Pediatric Dentistry and Orthodontics. So Larisa Alexandrova. So you are the last room we visited. Could you tell us what are you doing here? What you are thinking about your native profession and the future profession of our students?
Okay, thank you.
And say some words. Что-то, что вы можете сказать, вот глядя туда, нашим будущим студентам из Индии. So something that they want to say to students from India, future students from India. Larisa, you're welcome.
Thank you, dear Professor. First of all, good afternoon,
Yes.
our dear guests from India. I'm very happy to welcome you here, classes of the Department of Pediatric Dentistry. and you know,
Larissa, you may take it off.
okay, I will take them because it
For a
will be
moment.
louder.
Yes, yes.
So, welcome.
Mhm.
And dear guests, I think you just graduated from schools, and it is interesting to know right now, do you have pediatric dentists in your schools? And did you visit them regularly? It is very interesting.
So as you saw that we were in different classes, and I'm really shocked that even then in Russian students they're really speaking well English language, and they're really interested in our culture also. They know about our actors, the food, the tradition of ours. So
Yeah.
as we see that Russia and India, we have a really good relation. So that's why they really always happy to see us also here. So that's all thing I think.
Yes.
The session was really good. You want to add on something?
So I just want to invite our future Indian students to Russia, to the city of Perm, to Perm State Medical University, named after academician Evgeny Wagner, now supervising by extraordinary rector, Professor Kalyukina Irina Petrovna, and all my staff and all our colleagues and the whole dental team of Perm region will be happy to see Indian students in our university. So you're welcome. Don't be afraid. Take your bags, ask your parents, receive their positive decision, take your brothers, sisters, families, think about your future profit as a dentist, think about the dental health of all the members of your family, and come to Russia.